And because of the increase in incidence that we're seeing, spotting it early will save lives.
We've seen a 50% increase in incidence of oral cancer and mouth cancer in the past 10 years. What are the signs and symptoms we should be looking out for?
Well, I think before we talk about that, it's really important to understand the role of a dentist in that. You know, we as dentists perform an oral cancer screen for every single patient that comes through the door every 6 months as part of our normal checkup. You know, so when we ask patients to stick out their tongue and we're fiddling with the bottom of their mouths and we're looking at the back of their throat, that's what we're doing. We're doing an oral cancer screening. And we're probably in a unique position to be able to do that, and that's why it's so important to attend your regular checkups. And because of the increase in incidence that we're seeing, spotting it early will save lives, and we know that. But if you think about the signs and symptoms, they're very varied. You could be thinking about, and I think before I move forward on this, it's really important to make the point that a lot of signs and symptoms that you may think might be something dangerous, often, or actually in most cases, aren't. So things like if you get a swelling around your jaw or under your jaw that doesn't go away, these are the things that you should get checked out. If you have an ulcer in your mouth that doesn't disappear after 2 or 3 weeks, again, especially if it starts to become painful or if it starts to bleed and it's not healing. Other things that you might think of, if you're seeing white patches or red patches in your mouth, these are things that might be something that need further investigation, and if they don't go away, it's worth highlighting that to your dentist to have a look at. Other things like if you find that you can't speak in the same way as you used to be able to do, or you're having trouble swallowing. Again, this may be having a perfectly normal explanation, but it's worth getting it checked out. Sometimes teeth might become loose with an unexplained explanation, and hopefully your dentist would check that out and ensure that everything is nice and healthy. So there are lots of possible signs and symptoms of oral cancer. I probably missed a few. You might know of a few more, but it's important to just attend your dentist every 6 months, just to ensure that they are keeping on top of things.
Absolutely, and if at any point you're concerned, just book in, explain to a receptionist what you're concerned about, they'll book you in straight away. And if you're struggling to get an appointment, it's always worth taking a photo, and then you can always compare, or at least when you get to the dentist, you can then compare from the photo that you've taken.
Yeah.